Listen carefully. What I'm about to tell you could save your life. Every time you go to the bathroom, your body is trying to communicate with you. Yet, most people simply flush and walk away without a second thought. They have no idea their body may be screaming for help. And that mistake can be deadly. I know this sounds frightening, but I am Dr. Michael Kent, and I have seen this happen far too many times in my practice. People ignore the warning signs because they think what they're experiencing is normal. Then one day they're told they have cancer, and by that point it's often too late to do anything about it. Here is the truth that almost nobody talks about. Your stool is like a report card for your body. It gives you valuable information about what is happening inside you. The color can tell you about your liver and pancreas, or whether you may be bleeding internally. The shape can warn you if something is blocking your intestines, even something as serious as a tumor. The most alarming part is that the most dangerous type of stool can look almost normal at first glance. You might look into the toilet and assume everything is fine while something life-threatening is quietly growing inside you. That brief awkward moment when you glance into the toilet before flushing could genuinely save your life. Today, I want to show you exactly what to look for. I'll explain which types of stool are the most dangerous and when you need to run, not walk, to the emergency room. But my goal isn't just to scare you. I'm also going to give you practical, realistic solutions, simple steps you can start today to protect yourself. These are things that can help even if you're already taking medications, even if you have limited mobility, and even if you're living on a fixed income. The final 2 secrets I'll share are so powerful, they could significantly improve your health in just a few weeks. First, you need to understand something very important. Most people have no idea what Imagine your body as an incredibly sophisticated orchestra, with every instrument playing a vital role in maintaining harmony. Often, we focus on the most obvious melodies, a racing heart, a persistent cough, or a sudden headache. But beneath the surface, there's a quieter, often overlooked conversation happening, a language spoken by processes we rarely give a second thought to. One of the most insightful, yet frequently dismissed, communicators is our digestive system, and specifically, what leaves our body each day. For many, discussing stool feels taboo, an uncomfortable topic reserved for hushed doctor's visits. Yet, what we flush away holds a wealth of information, a daily report card on our internal health that can reveal everything from dietary imbalances to serious underlying conditions. Ignoring this silent language is akin to ignoring the smoke alarm in your home. It might seem like a minor inconvenience now, but it could be signaling a much larger, impending danger. Think about it, from the moment food enters our mouth to its eventual exit, a complex dance of digestion, nutrient absorption, and waste elimination unfolds. Every step is meticulously orchestrated. When this intricate process is disrupted, our body sends signals. These signals aren't always dramatic pain or fever, sometimes, they are subtle changes in our bowel movements. A slight alteration in color, an unexpected texture, or a shift in frequency, these can be whispers from within, nudging us to pay closer attention. We're often taught to scrutinize our skin, our eyes, our energy levels, but the daily act of defecation, despite its primal importance, remains a largely unexamined ritual. This oversight is dangerous because our gut health is inextricably linked to our overall well-being, influencing everything from our immune system to our mood. It's time to break the silence and learn to interpret these vital messages. The human body is an amazing self-regulating machine, constantly striving for balance. However, in our fast-paced modern lives, filled with processed foods, chronic stress, and sedentary habits, this delicate balance is often tipped. Our digestive system, the frontline warrior against environmental aggressors and dietary indiscretions, bears the brunt. What we see in the toilet bowl is the final act of a long play, a summary of how our body is coping with what we put into it and the environment it navigates. From the vibrant shades of our diet to the subtle nuances of our hydration, our stool can tell a story of nutrient absorption efficiency, inflammation, or even the presence of pathogens. It's a direct window into the state of our internal environment, providing clues long before more overt symptoms might manifest. Many serious health issues, from irritable bowel syndrome, IBS, and Crohn's disease to celiac disease and even colorectal cancer, can manifest their early warning signs through changes in stool. Yet, a common response is to dismiss these changes as temporary, or to self-diagnose based on incomplete information from the internet. This procrastination, fueled by discomfort or embarrassment, often leads to delayed diagnosis and treatment, turning easily manageable conditions into complex health challenges. The silent whispers can escalate into urgent screams if left unaddressed. Understanding the nuances of what constitutes normal for your body, and recognizing deviations from that norm, is the first critical step towards proactive health management. It's about empowering yourself with knowledge. This program is dedicated to demystifying the often ignored language of our digestive system. We'll embark on a journey together, transforming what might feel like an awkward topic into an empowering conversation about self-awareness and preventative health. We will explore the Bristol stool chart, decipher what different colors mean, understand the significance of shape and texture, and learn when changes in frequency warrant a visit to the doctor. By the end, you'll be equipped with the tools to confidently interpret your body's daily report card, recognizing the subtle signals that pave the way for a healthier, more vibrant you. Don't let discomfort be a barrier to understanding your body's most honest, daily voice. Your health truly depends on it. Welcome back, friends. In our last segment, we touched upon the silent language our bodies speak, and perhaps no message is more often overlooked, or even dismissed, than what our stool can tell us. It might sound a bit unconventional, but your bowel movements are actually a crucial daily report card from your digestive system. Today, we're going to demystify this fascinating topic with a truly remarkable tool, the Bristol stool chart. Imagine having a simple, visual guide that helps you understand if your digestive system is humming along smoothly, or if it's struggling. That's exactly what the Bristol stool chart offers. Developed by doctors at the University of Bristol, this chart categorizes human feces into 7 distinct types, based on their shape and consistency. It's not just a medical tool, it's a universal language for your gut health, making it easier for you and your doctor to have those important conversations, without embarrassment. Let's dive into the 7 types. Type 1, for instance, looks like separate hard lumps, much like nuts. If you consistently see this, it often points to severe constipation. It suggests your stool has spent a long time in the colon, losing a lot of water. Type 2 is sausage-shaped but lumpy, also indicative of constipation, though less severe than Type 1. These first 2 types are often associated with difficulty passing stool and can be uncomfortable, even painful. Recognizing them is the first step towards relief. Now, let's talk about the ideal. Types 3 and 4 are generally considered the gold standard for healthy digestion. Type 3 is sausage-shaped with cracks on the surface, while Type 4 is smooth and snake-like, passed easily. These 2 types suggest optimal hydration, a healthy fiber intake, and a digestive system working efficiently. They are easy to pass and indicate that your body is absorbing nutrients well and eliminating waste effectively. When you see these, you can breathe a sigh of relief. Your gut is likely happy. Moving to the other end of the spectrum, we have types 5, 6, and 7. Type 5 consists of soft blobs with clear-cut edges, passed easily, often seen when you're slightly constipated but trying to pass stool. Type 6 is fluffy pieces with ragged edges, a mushy stool, signaling mild diarrhea. And finally, Type 7 is entirely liquid, with no solid pieces, indicating severe diarrhea. These types suggest that waste is moving through your system too quickly, or your body isn't absorbing enough water, possibly due to an infection, food intolerance, or other underlying conditions. Understanding these variations helps you recognize when something might be amiss. Remember, consistency is key, and sudden changes are worth noting. This chart is a friendly companion in your journey towards better health. Our bodies are incredible storytellers, aren't they? They constantly send us signals, subtle whispers and sometimes, urgent shouts, about what's going on inside. And one of the most intriguing, yet often overlooked, communicators is the color of our stool. It might sound a bit unconventional to focus on, but trust me, understanding these hues can provide a surprising amount of insight into your digestive health and even warn you about potential issues lurking beneath the surface. Let's begin with the familiar. What's considered normal? Most of us are used to seeing shades of brown, ranging from light tan to a deeper chocolate. This comforting brown color is usually a sign that everything is working as it should, a perfect blend of bile and waste products. Bile, a greenish-yellow fluid produced by the liver, plays a crucial role in digestion, breaking down fats. As it travels through your intestines, enzymes and bacteria alter its pigments, transforming it into the healthy brown we recognize. But what if the spectrum shifts? Imagine seeing a vibrant green. Before you panic, consider your diet. Eating a lot of leafy greens like spinach or kale, or even consuming foods with green food coloring, can temporarily tint your stool this way. Iron supplements can also have this effect. However, if green stool persists without a clear dietary explanation, it could indicate that food is moving through your digestive tract too quickly, a condition called rapid transit. This means the bile hasn't had enough time to break down and change color properly. While often benign, persistent rapid transit might be worth mentioning to your doctor, especially if accompanied by other symptoms. Then there are the colors that truly give us pause. Yellow, greasy, and foul-smelling stool can be a red flag. This often points to an excess of fat in your stool, a condition known as steatorrhea. It suggests your body isn't absorbing fats properly, which could be due to issues with the pancreas, celiac disease, or other malabsorption disorders. While a one-off instance after a particularly rich meal might be harmless, persistent yellow, greasy stool definitely warrants a conversation with a healthcare professional to uncover the underlying cause. Don't ignore these specific signs. Now, let's talk about the more alarming hues. Black or tarry stool, medically known as melena, is a serious warning sign. It often indicates bleeding in the upper gastrointestinal tract, such as the stomach or small intestine. The blood turns black as it's digested, resembling coffee grounds. Certain medications, like iron supplements or bismuth subsalicylate, found in some antidiarrheal drugs, can also cause black stool, but it won't be tarry or foul-smelling. If you experience black, tarry stool, especially with weakness, dizziness, or abdominal pain, seek immediate medical attention. Similarly, bright red stool or streaks of red blood can signal bleeding in the lower GI tract, like hemorrhoids, diverticulosis, or inflammatory bowel disease. While a small amount of bright red blood can be benign, like from a small tear or hemorrhoid, any significant or persistent red blood should be evaluated by a doctor to rule out more serious conditions. And finally, white or clay-colored stool is almost always a cause for concern. This often suggests a lack of bile, which could be due to a blockage in the bile ducts caused by gallstones, tumors, or liver problems. Since bile gives stool its brown color, its absence results in a pale appearance. This symptom requires urgent medical evaluation to identify and address the underlying issue promptly. Your body is always talking, it's up to us to listen to its important messages. Welcome back to our journey of understanding what our bodies are trying to tell us. We've already delved into the intriguing world of stool colors, but just as a masterpiece isn't judged solely by its palette, our digestive health story isn't complete without examining shape and texture. Think of your stool's form as another crucial chapter in your internal dialogue, offering profound insights into hydration levels, dietary fiber intake, and the overall efficiency of your digestive system. It's a map that can guide us to better health, a silent narrator of your internal state. Let's unlock these secrets, transforming what might seem like a mundane topic into a fascinating exploration of your digestive health journey. The gold standard, the kind we all aspire to, often falls into types 3 and 4 on the Bristol stool chart. Imagine a smooth, soft, sausage-like shape, or a snake-like form with cracks. These indicate a well-hydrated system and a balanced diet rich in fiber, allowing waste to pass easily and comfortably. This is the happy medium, suggesting that your gut is working harmoniously, absorbing nutrients effectively, and eliminating waste efficiently. It's a reassuring daily check-in, a comfortable rhythm, and a strong sign of harmony. Now, let's consider the other end of the spectrum: stools that resemble hard, separate lumps, like nuts, type 1, or a lumpy sausage, type 2. These are often the telltale signs of constipation. When your stool is dry and difficult to pass, it typically points to insufficient fiber and dehydration. Your colon is working overtime, but without enough water to soften the waste, it becomes a struggle. Chronic constipation can lead to discomfort, bloating, and even more serious issues over time. Increasing your water intake and incorporating more fiber-rich foods like fruits, vegetables, and whole grains can often alleviate this, but persistent issues warrant professional medical advice. On the flip side, we have stools that are soft blobs with clear edges, type 5, mushy, type 6, or entirely liquid, type 7. These signify various forms of diarrhea and can be a red flag. Type 5 might indicate a mild imbalance or sensitivity, while type 6 and 7 scream urgency and potential distress. Common culprits include infections, food intolerances, stress, or certain medications. While occasional loose stools can be benign, persistent or severe diarrhea can lead to dehydration and nutrient loss, and should prompt seeking medical attention. Beyond these common forms, other textures can provide specific clues. Stools that are greasy, pale, and float persistently might indicate malabsorption of fats, suggesting issues with the pancreas or gallbladder. Very thin, pencil-like stools, especially if a sudden and persistent change, could signal an obstruction in the lower bowel, which is a serious concern. Observing these details, understanding their potential meanings, and acting when necessary is an act of self-care. Your body is constantly communicating. It's up to us to listen to your body's whispers. Welcome back to our journey of understanding our bodies. In this chapter, we delve into a topic often whispered about, if discussed at all, the frequency and changes in our bowel habits. Just like our fingerprints, our bowel movements are uniquely ours. What's normal for one person might be alarming for another. The key isn't a universal standard, but rather recognizing your individual's unique rhythm. Generally, a healthy frequency can range anywhere from 3 times a day to 3 times a week. That's a pretty broad spectrum, right? And it highlights why consistency for you is paramount. A sudden, significant deviation from your established pattern is what truly warrants attention. We're talking about shifts that aren't just a one-off day, but something that persists. For instance, if you usually go once a day and suddenly find yourself going 3 times, or conversely, not at all for several days, it's a signal your body might be sending. These changes can be acute, appearing suddenly, or chronic, developing gradually over time, settling into a persistent new normal. Let's first consider an increase in frequency, especially if accompanied by loose or watery stools, what we commonly call diarrhea. While a bout of acute diarrhea often resolves on its own, perhaps due to a temporary bug or something you ate, persistent diarrhea lasting more than a few days, or recurring frequently, needs attention. Even more concerning are symptoms like severe abdominal pain, fever, dehydration, or the presence of blood or black, tarry stools. These are immediate red flags that warrant urgent medical consultation. On the flip side, a decrease in frequency, or constipation, is equally important. If you're suddenly going much less often than your usual, experiencing straining, hard stools, or feeling incomplete emptying, your body is speaking up. Again, occasional constipation can be due to diet changes, dehydration, or stress. But if it lasts for more than a week, or if it's accompanied by severe abdominal pain, bloating, vomiting, or an inability to pass gas, these could be signs of a more serious issue requiring you to seek professional advice. Beyond just frequency, consider the context. Have you recently changed your diet, started a new medication, traveled, or experienced unusual stress? These external factors can often temporarily alter bowel habits. However, if changes persist, seem unrelated to lifestyle adjustments, or come with other concerning symptoms like unexplained weight loss, fatigue, or changes in appetite, it's crucial not to dismiss them. Your body is a finely tuned instrument, and persistent changes in its rhythm are often its way of communicating a need for closer examination. Listen to your body's quiet wisdom. Welcome back, friends. We've talked about the Bristol stool chart, the mysterious colors, and the curious shapes and frequencies of our stool. Now, let's explore a fascinating and often reassuring aspect: how what we put into our bodies, both as medicine and food, can naturally influence what comes out. It's a common source of worry, but often, these changes are completely normal. First, let's talk about medications. Many common drugs can subtly, or sometimes dramatically, alter your stool's appearance. Take antibiotics, for example. They're powerful defenders against harmful bacteria, but in doing so, they can also disrupt the delicate balance of good bacteria in your gut. This imbalance can lead to diarrhea or a softer, lighter-colored stool. It's usually temporary and resolves once the course of medication is finished. Iron supplements, crucial for those with anemia, are another frequent culprit. They are notorious for turning your stool a very dark green or even black. This isn't usually a sign of bleeding but rather the unabsorbed iron passing through your system. Antacids, especially those containing aluminum, can cause constipation, while magnesium-based antacids might have the opposite effect, leading to looser stools. Even certain anti-inflammatory drugs, NSAIDs, can sometimes irritate the gut lining, potentially causing subtle changes. The key here is to be aware of the medications you're taking and their known side effects. If you start a new medication and notice a change in your bowel habits, check the patient information leaflet or consult your pharmacist. It's empowering to understand these connections rather than immediately jumping to concerning conclusions. Now, let's turn to the delicious world of food. Our diet is perhaps the most frequent and understandable cause of stool variations. Think about those vibrant red beets. Eating them can turn your urine pink and your stool a reddish hue, which can be alarming if you're not expecting it. Similarly, dark leafy greens like spinach or kale, rich in chlorophyll, can make your stool appear greenish. Even artificially colored foods, like brightly colored cereals or desserts, can show up in your stool with surprisingly similar shades. High-fiber foods, while excellent for gut health, can initially lead to increased bulk and frequency as your body adjusts. Conversely, a diet very low in fiber might contribute to harder, less frequent stools. Fatty foods, particularly when consumed in excess, can sometimes result in pale, greasy, foul-smelling stools that are difficult to flush, a condition known as steatorrhea. While occasionally normal after a particularly rich meal, persistent steatorrhea could indicate an issue with fat absorption and warrants a doctor's visit. So, how do we differentiate between a harmless, diet or medication-induced change and something more serious? The most important factor is consistency and context. If you know you just had a beet salad, a reddish tint is likely from the beets. If you started iron pills, black stool is probably the iron. These changes are typically transient. Once the offending food or medication is out of your system, your stool should return to its normal appearance. Furthermore, diet and medication-related changes are usually isolated. They don't typically come with other worrying symptoms like severe abdominal pain, persistent vomiting, unexplained weight loss, or a fever. If you experience these accompanying symptoms, or if the change in stool color or consistency persists for more than a few days after you've stopped the suspected food or medication, if safe to do so, it's time to speak with a healthcare professional. Understanding these common influences empowers you. It allows you to observe your body with curiosity rather than fear, recognizing the fascinating interplay between what you consume and your digestive process. Being informed helps you to distinguish between the normal variations of a healthy, dynamic system and the subtle whispers that might signal a need for medical attention. It's about building a trusting relationship with your body, where you understand its language and respond appropriately, always prioritizing your well-being. In essence, your stool is a mirror reflecting your recent dietary choices and medical inputs. It's an honest messenger. By understanding its potential reactions to medicines and food, you gain valuable insight into your digestive health. Remember, knowledge is power, and when it comes to your health, being informed is your best defense. Don't let normal variations cause undue stress. Instead, use this understanding to your advantage, making informed decisions about your health journey. Chapter 7. Act Now. When to call the doctor or head to emergency. We've journeyed through the fascinating world of our digestive system, learning to decipher the subtle messages our bodies send through our stool. We've explored the Bristol stool chart, decoded colors, shapes, and frequencies, and understood how diet and medication can influence these patterns. But what happens when the signals become more urgent, when they whisper of something beyond a simple dietary tweak? Knowing when to transition from a watchful observer to someone seeking professional medical attention is perhaps the most crucial lesson of all. Sometimes, our bodies don't just whisper, they speak louder, demanding our immediate attention. It's about recognizing the difference between a temporary blip and a persistent warning sign. If you notice a significant, unexplained change in your stool's color, consistency, or frequency that lasts for more than a few days, it's time to pick up the phone. This is especially true if these changes are accompanied by other new symptoms like unexplained weight loss, persistent abdominal discomfort, or a change in appetite. A little bit of bright red blood on the toilet paper, not mixed into the stool, might suggest hemorrhoids, which often warrant a non-urgent doctor's visit. However, any new bleeding should always be discussed with a healthcare professional to rule out anything serious. There are certain scenarios where your body isn't just speaking, it's shouting for help, requiring immediate emergency care. These are the red flags you must never ignore. The most alarming sign is heavy rectal bleeding. This isn't just a few streaks, it's a significant amount of bright red blood in the toilet or on your underwear, potentially accompanied by dizziness, weakness, or a rapid heartbeat. Another critical emergency is black, airy stools, melena, which indicates bleeding higher up in the digestive tract. These stools often have a distinct, foul odor. If you experience these, do not delay, head straight to the emergency room. Beyond bleeding, other critical symptoms demand urgent medical attention. Sudden, severe abdominal pain that comes on quickly and intensely, especially if it's accompanied by fever, persistent vomiting, or an inability to pass gas or stool, could signal a serious condition like appendicitis, a bowel obstruction, or diverticulitis. Similarly, if you experience persistent, severe diarrhea or vomiting that leads to signs of dehydration, feeling excessively thirsty, having dry mouth, urinating less often, or feeling lightheaded, emergency care is essential to prevent complications. Finally, pay close attention to systemic signs that point to more profound issues. If your skin or the whites of your eyes turn yellow, a condition known as jaundice, it could indicate a problem with your liver or bile ducts, requiring immediate medical evaluation. Any change in mental status, such as confusion, lethargy, or unresponsiveness, especially when combined with gastrointestinal symptoms, should also trigger an immediate emergency visit. Remember, when in doubt, it is always better to err on the side of caution. Your health is your most precious asset, and listening to its loudest cries can be life-saving. Don't hesitate to seek professional help when your body signals distress. Your prompt action can make all the difference. After understanding the critical signs and when to seek medical help, let's shift our focus to proactive measures. Imagine your gut as a delicate garden. To thrive, it needs consistent care, not just emergency interventions. It's about building resilience from within, creating an environment where good bacteria flourish and your body feels its best. These aren't drastic changes, but small, consistent habits that can make a monumental difference over time, transforming your daily well-being. So, let's explore 5 simple yet powerful lifestyle tips to nurture your inner ecosystem and ensure your gut health is protected. First, embrace fiber. Often overlooked, fiber is the superhero of gut health. Think of it as the ultimate food for your beneficial gut bacteria. When you eat a diet rich in diverse plant foods, fruits, vegetables, whole grains, legumes, nuts, and seeds, you're essentially providing a buffet for these microscopic allies. They ferment the fiber, producing short-chain fatty acids that nourish your gut lining, reduce inflammation, and even strengthen your immune system. It's not just about regularity, it's about feeding the good guys. Start by adding an extra serving of veggies to each meal or swapping white bread for whole wheat. Small swaps yield big benefits, transforming your diet into a powerhouse for gut wellness. Second, hydration is key. Water might seem simple, but its role in digestion and gut health is profound. Adequate water intake keeps things moving smoothly through your digestive tract, preventing constipation and ensuring nutrients are properly absorbed. Dehydration can lead to a sluggish digestive system, making it harder for your body to eliminate waste effectively. Aim for at least 8 glasses of water a day, and remember that herbal teas and water-rich foods like fruits and vegetables also contribute. Think of water as the gentle river that carries away impurities and helps your gut perform its vital functions with ease and efficiency. Third, manage your stress. The gut-brain axis is a powerful two-way street. When you're stressed, your brain sends signals that can disrupt digestion, alter gut motility, and even change the composition of your gut microbiome. Chronic stress can literally make your gut more permeable, leading to inflammation and discomfort. Incorporating stress-reducing practices into your daily routine is not a luxury, but a necessity. This could be anything from mindful breathing exercises, spending time in nature, practicing yoga, or simply dedicating a few minutes each day to a hobby you love. Prioritizing mental well-being is a direct investment in your gut's happiness and overall health. Fourth, move your body regularly. Physical activity isn't just for your muscles and heart, it's a fantastic stimulant for your digestive system. Exercise helps increase blood flow to your gut, promotes healthy bowel movements, and can even positively influence your gut microbiome diversity. You don't need to become an athlete, even a brisk 30-minute walk most days of the week can make a significant difference. And finally, fifth, prioritize quality sleep. Sleep deprivation can wreak havoc on your entire body, including your gut. It disrupts your circadian rhythm, which plays a role in gut function, and can negatively impact your gut bacteria. Aim for 7 to 9 hours of restorative sleep each night. Creating a consistent sleep schedule and a calming bedtime routine can do wonders. Remember, a happy gut is often a well-rested gut, allowing it to repair and rejuvenate overnight, setting you up for a day of optimal digestive health. Throughout this journey, we've explored the intricate language of our bodies, specifically focusing on the often overlooked yet profoundly important signals from our digestive system. From the nuanced interpretations of the Bristol stool chart to the alarming implications of unusual colors and shapes, we've learned that our stools are not just waste, they are daily reports, silent messengers detailing the state of our internal world. Ignoring these messages is akin to overlooking a flickering check engine light in your car. A small sign now could prevent a catastrophic breakdown later. Your gut is a complex ecosystem, a second brain, influencing everything from your mood to your immunity. Understanding its rhythm and recognizing deviations is the first step towards true proactive health management. We've delved into the common culprits behind changes, from dietary choices and medication side effects to stress and travel. We've learned to differentiate between temporary fluctuations and persistent red flags that demand attention. Remember, knowledge is power, and equipped with this understanding, you are no longer a passive observer but an active participant in your well-being. This isn't about fostering anxiety with every bathroom visit, but rather cultivating a gentle, informed awareness. It's about building a respectful relationship with your body, where you listen, understand, and respond with care. This journey of discovery empowers you to become your own health advocate, making informed decisions rather than guessing. The most crucial takeaway is this: never underestimate the power of persistent symptoms. A slight discomfort that doesn't go away, a change in frequency that becomes the new normal, or an unusual color that reoccurs, these are not minor inconveniences to be swept under the rug. They are urgent invitations from your body, asking for your attention and potentially, professional help. We discussed the critical moments when it's imperative to consult a doctor, and especially, when immediate emergency care is required. These guidelines are not meant to scare but to prepare you, ensuring you know exactly when to seek expert medical advice without hesitation. Our final call to action is simple yet profound: prioritize your gut health. It's the cornerstone of overall vitality. Incorporate the 5 simple lifestyle tips we shared: embrace a fiber-rich diet, stay hydrated, manage stress, get regular exercise, and consider probiotics when appropriate. These aren't just recommendations, they are foundational pillars for a thriving digestive system and, by extension, a healthier, happier you. Small, consistent changes can lead to monumental improvements in how you feel, function, and even think. Your gut microbiome influences so much more than digestion. It plays a critical role in nutrient absorption, hormone regulation, and even mental clarity. So, as we conclude this comprehensive guide, I urge you to carry this newfound knowledge forward. Make listening to your body a daily practice, not an occasional reaction. Trust your instincts. If something feels off, investigate. If a symptom persists, seek professional guidance. Your body is an incredible, resilient machine, constantly working to maintain balance. Give it the attention and care it deserves. By understanding and responding to its subtle whispers and its louder shouts, you are investing in a lifetime of better health. This isn't just about avoiding illness, it's about embracing a vibrant, full life. Remember, your body talks. Are you listening? So, as we draw our journey to a close, remember this: the true power isn't just in acquiring knowledge, but in how we apply it. It's about taking those insights, that wisdom, and transforming them into action that shapes a better future. Each step you've taken, every challenge you've overcome, has forged a stronger, more capable you. You are not just a spectator in this grand design, you are a vital contributor, an architect of tomorrow. Embrace the continuous learning, the boundless possibilities, and the profound impact you're destined to make. Go forth, with purpose and passion, and illuminate the world with your unique brilliance. The future is not just waiting for you, it's being built by you, right now, with every choice and every endeavor. Let your legacy be one of courage, innovation, and an unwavering commitment to progress. The journey continues, and your story is just beginning.